Good afternoon. My name is Rachel Cady. I'm a OBGYN. I practice at Cuyuna Regional Medical Center in Crosby, as well as in Aiken, Minnesota, at Riverwood, and Wellia and Mora. And March is Endometriosis Awareness Month, and so wanted to take this opportunity to just talk a little bit about endometriosis, primarily what is it, how is it diagnosed, and some of the treatment options that are available. So endometriosis is something that affects many women. Primarily, these women will present with chronic pelvic pain, which is defined as pain of 6 months duration or longer. Sometimes their pain is more symptomatic with bowel symptoms, like bearing down to have a bowel movement, or bladder symptoms, a lot of times feeling like they have to void frequently, getting up a lot at night to void, and usually associated with some degree of pain with that, as well as uterine or ovarian pain, painful periods, pain with intercourse, can be vulvar pain, meaning on the outside area, as well as vaginal pain. So everybody's a little bit different. Up to about a third of women with chronic pelvic pain have endometriosis. And that in and of itself, endometriosis, really the definition is it's the lining of the uterus. That's that part that sheds with your period or where a baby implants. The lining of the uterus, which is found anywhere outside of the uterus. If we take all women who present with their primary symptoms being really painful periods and also pain with deep penetration with sex, 80% of those women will actually have endometriosis. This pain negatively affects a woman's quality of life. And interestingly, a lot of times when we see these patients, really it's kind of just become their new normal. So they almost forget what normal is. I'm going to just show you, this is a little bit of a blurry picture, which I apologize for, but the organ in the middle is the uterus. This is looking down into the pelvis from the belly button with a laparoscopy, like a minimally invasive surgery. We're looking into the pelvis with a camera. So the organ in the middle is the uterus, and you see all this brown kind of staining, and that's endometriosis. It's not always brown, but again, it's the lining of the uterus found outside of the uterus. And sometimes it's clear, sometimes it's red, but produces a lot of inflammatory factors, which causes severe cramping and all the other symptoms potentially that we were talking about. It's important to note that the only way to definitively diagnose endometriosis is surgically, meaning you actually look and see it. It oftentimes is not present on ultrasounds or CT scans or whatever. So not everybody needs surgery, but the only way to actually prove somebody has it is by doing a surgery, taking a little piece of that brown tissue and actually confirming it with pathology. So again, kind of reviewing the common symptoms of endometriosis. So this is a picture of the uterus, an animated drawing of the uterus, the tubes on the sides as well as the ovaries. And that lining found outside of the uterus or on the surface of the uterus. And each of those little implants produces a lot of inflammatory factors that cause blood vessels to dilate, causes swelling, really a lot of the same factors that are present, like if you sustain an injury, if you get a bruise, or if you get a cut, those same factors that your body's cells produce, like histamines, things called interleukins, things that are very inflammatory and uncomfortable. So painful periods, painful intercourse, in some cases infertility, because it can in some people cause tubal damage, can make ovulation or releasing an egg less frequent. Again, not for everybody. Generalized weakness is really common just because, people that are having chronic pain are not people that are really energized. They're not people that feel well. And also a lot of times excessive bleeding or irregular bleeding. These are patients a lot of times that are on some sort of hormonal management, yet they're still having lots of breakthrough bleeding and pain. So again, this is just another animated drawing of the uterus labeled here. The endometriosis they have labeled as well. And it's important to note too that interestingly, the amount of endometriosis somebody has does not correlate with their symptoms. So really what we care about is it present or not? So again, why does endometriosis cause pain? And what causes endometriosis in the first place? And nobody really knows what causes endometriosis. Why do some people have it? Why do some people don't? How come some people have a lot of symptoms, others don't? Those are all things that we still don't really understand. There's some theories about it. So the cause is unknown, but we know what the fertilizer is for endometriosis, meaning we know what makes it grow, and it's estrogen from the ovaries, that hormone from the ovaries. And we need estrogen. I mean, there's a lot of really good things about estrogen, but that is what makes endometriosis grow. Now, endometriosis implants, again, as I was saying, make a lot of inflammatory factors that cause pain. And these implants can be anywhere outside of the uterus. It can be on our nerves, our bladder, our bowel, our pelvic ligaments, even in some cases, certainly less commonly, but even in our chest cavity. So this causes tension, inflammation, swelling, and as I was saying, a lot of times heavier, painful, at times irregular periods and other symptoms. So let's briefly just go over some of the treatment options. Now, surgery is a great treatment for confirming the diagnosis and treating patients who are not responding with medical management. And what's involved with this typically is a minimally invasive surgery where we put a camera through the belly button, that's called a laparoscope, and usually 2 other incisions. And essentially we're looking to either confirm the diagnosis and removing it with little laparoscopic scissors and cauterizing it away. Long-term management are oftentimes with medications that essentially work to suppress ovulation, to regulate our estrogen levels, lower estrogen levels. Also NSAIDs, that's primarily naproxen, ibuprofen, those kind of medications, but not doing too much of that, but certainly an anti-inflammatory effect is important. Birth control pills, commonly Depo-Provera, progesterone-based IUDs work locally to decrease inflammation and oftentimes decrease menstruation. Lupron injections, that's a shot to lower somebody's estrogen levels, so it's taking away that fertilizer from the endometriosis. There's a newer player on the block that came out a few years ago called elagolix, and this also, this is an oral option that can be given either once or twice daily, and it's an anti-estrogen as well. It's taking away that fuel for the fire, if you will. It's lowering people's estrogen so that there's not as much inflammation from the endometriosis. It's kind of starving it of its fuel. There's also certainly more advanced treatment options like neuromodulators and physical therapy. So those are some of the things. You know, as far as when we consider surgery is when a definitive diagnosis is needed. Maybe, you know, we're assuming somebody has endometriosis, we're treating them that way, but they're just not getting optimal results. So in those cases, a lot of times we will discuss surgery. And if they need a fertility evaluation, somebody that has a lot of pelvic pain and is really having a hard time getting pregnant, just needing that evaluation, we'll oftentimes talk about doing a laparoscopy at that point as well. And it's important to note that after surgery, usually we do recommend, unless somebody's trying to achieve pregnancy, continuing to suppress endometriosis with some sort of combined medical and wellness treatment. So in essence, the take-home message is this, that endometriosis is absolutely a chronic condition that is manageable with many different treatment options. And establishing that diagnosis and a care plan with a provider is really key to improving quality of life. There was a slogan that came out not long ago called, quote, her endometriosis journey, end quote. And it really is that, you know, if you think of this as a chronic condition, just how important it is to follow up and to be checking in with your provider. Everybody's different as far as how often they need to check in, but there's a whole bunch of options, and it's really addressing that person's individual symptoms, what their goals are at the time, and making appropriate decisions from there. So thank you so much for your time, and you can certainly submit questions as well to us, and we'll get back to you. Thank you.